Your lung health check. Easy read. Lung health checks. Lung health checks are being offered to people in your area aged between 55 and 75 who smoke or used to smoke. You have been offered this check because we want to find out how well your lungs are working. A lung health check can help you find problems early, often before you notice anything is wrong. Bringing your friends. You can bring a friend, family member, or partner with you to the lung health check. What happens at a lung health check? Your lung health checks will take about 30 minutes. The nurse will ask you some questions about your breathing. They will ask you about your everyday life, your family, and your health. You will be asked to blow into a handheld machine called a spirometer to see how well your lungs are doing. The nurse may ask you about having a lung scan. A lung scan checks for lung cancer. Your information. We will ask if we can share your lung health check information. Asking questions. We will make sure you have plenty of time to chat to the nurse and ask questions. Different to NHS health checks. NHS lung health checks are different to NHS health checks. Even if you've recently been for a health check, you should still think about going to your lung health check. The results of your lung health check. At the end of the lung health check, we will tell you 1. No problem found. We will write to your doctor so they know about the check. 2. Go and see your doctor. If we find problems with your breathing or lungs, the nurse may suggest you go and see your doctor. We will write to your doctor so they know about the check. 3. Offer you a lung cancer scan. We will suggest you go for a lung cancer scan if we think you might get lung cancer in the future. A scan is where we take pictures of the inside of your body. The nurse will help you to choose whether the scan is right for you. We will write to your doctor so they know about the scan. What is lung cancer? Lung cancer is one of the most common types of cancer. At the start, there are usually no signs that you have lung cancer. You won't know that you have lung cancer. Finding cancer earlier means that it can be treated. We've set up this lung cancer check so we can find out and treat lung cancer early. Lung cancer is when some of your cells grow to form a tumor in your lung. A tumor is a lump of cancer cells. All of your body is made up of tiny cells. What happens during a lung cancer scan? You will lie flat on your back on a bed that moves slowly into a machine called a scanner. The scanner is shaped like a donut, and it will move around your chest as your body passes through it. Staff control the scanner from behind a screen. You can see and speak to them during the scan. You will need to lie still for about 10 seconds. The staff will tell you how to breathe during the scan. You won't feel anything. You'll be able to eat, drink, or drive as normal after your scan. Choosing to have a scan. It's up to you if you have a scan or not. Having a scan means that we are more likely to find problems early. If we find lung cancer early, it can be cured. The treatment is simpler. You are less likely to die. It is better to find your lung cancer when it is small before it has spread to the rest of your lungs. What is the harm from a scan? Radiation. A dose of radiation can cause harm, but we use a dose of radiation that is very low. A wrong result. Sometimes the scan does not show that you have lung cancer. This is very uncommon. Sometimes the scan shows that you may have lung cancer, but you don't. This will lead to you having more tests, which can be worrying. Sometimes a scan will pick up something that would never cause you any harm. This would also lead to more tests that may be worrying. You will be supported throughout the process. The results of your scan. You will get your results within 4 weeks. We will write to you and your doctor with the results of the scan. The results may be 1. We have found nothing wrong. We will write to you with the results and ask you to come back for another scan in 2 years. 3 out of every 4 people who have a scan have nothing wrong. 2, you need another scan. This usually means that we saw something that we need to check again. We will write to you and your doctor and ask you to come for another scan. Usually it will be in 3 months' time. About 1 in every 6 people need to go for another scan. 3, something wrong. This means we have seen something and we want you to come for more tests. About 1 in every 12 people that we scan need to go for more tests. We will call you and write to the hospital so you can be seen by a doctor. Around half the people who need more tests will have lung cancer. 4, something else wrong. There is no sign of lung cancer, but the scan makes us think that you may have another problem. You may need to see your doctor or another doctor. We will write to you and your doctor. Signs and symptoms of lung cancer. You need to look out for anything unusual like a cough that doesn't stop, coughing up blood, being short of breath, getting very tired or losing weight, an ache or pain when you breathe or cough, not wanting to eat anything. If you notice any of these things, you should go and see your doctor. Support to stop smoking. The best thing to reduce your chances of getting lung cancer is to not smoke. If you do smoke and you would like to stop, speak to your doctor. Phone the NHS Smoke Free on 0300 123 1044. Go to www.nhs.uk/smoke-free. For more information, you can contact some of the organisations on this page with the details of how to do this, such as NHS Lung Cancer Information, NHS Smoke Free, Cancer Research UK, and the Roy Castle Lung Cancer Foundation.